Good morning, welcome to my channel. My name is Dr. Chandra Small and I'm a pharmacist, I'm a mom, I'm an anxiety coach. Today I want to talk about peanut allergy in children because I have a 7-month-old and I just challenged her on a peanut product. So she's almost 7 months, she'll be 7 months on Tuesday, and kids tend to have less allergies when you expose them early. Not as early as 4 months, but between 4 and 6 months, closer to 6 months, right? So I did the same thing with my first daughter, decided to give her a peanut product. Let me grab it. It's like, where did you go? The phone was like, where did you go? Okay, so I have it on this swivel situation, and I kind of like it. Okay, so this is the peanut product. I've never heard of it. It's called Bomba. I got it from Trader Joe's, but they sell it all over the place, right? So these are little peanut snacks. So ingredients are peanut butter, corn grits, high oleic, sunflower oil, and salt. That's it. They're pretty healthy. They're actually a good snack for kids and adults, or older kids and adults as well. So I gave her a couple of these on 2 occasions. I noticed that later, I don't know when it started, but she had a rash under her neck, like between the folds. You know, 7-month-olds still have lots of folds. So I didn't think, I was like, oh, she has a rash. But also earlier I had fed her oatmeal and it got all over her neck and stuff. But I don't think it was the oatmeal because oatmeal is usually pretty soothing. So I'm assuming maybe it was the peanut snack. I don't know. But, so let's go into peanut allergy. Peanut allergy is a hypersensitivity type 1 reaction. Usually there's a sensitization and then there's effect. A sensitization means that you're exposed to something you're potentially allergic to, but you don't have a reaction. An effect is when you're exposed to it again and you have a reaction. So the thought process is when the first time you get exposed to something, your body starts making antibodies, different things to protect you when you're exposed again. Just like we do with, that's the point of vaccines. The vaccines give you little bits and pieces, usually of a dead virus, so that your body can build up an immune response. So if you're exposed to it again in the future, your body got you. It protects you, right? So when there's a food allergy, however, or any kind of allergy where your body goes out of control, it's building up too much of an immune response. So when the baby has the peanut product again, the body is reacting, but it's overreacting. So let's talk about what that looks like. A baby can get a wide variation of reactions from a peanut allergy. Hives, rash, they can get wheezing, nausea, vomiting, stomach cramps. And I mean, how do you know if your baby has stomach cramps? They're crying. You're thinking that they're hungry, and really their stomachs are hurting. That's a hard one, right? Coughing, throat tightness, anaphylaxis is the most life-threatening. Anaphylaxis is where, if you've ever seen the movie My Girl with Macaulay Culkin a long time ago, and he had a bee sting and he died, he had anaphylaxis. Throat closes up, you can't breathe. That is a 100% 911 emergency situation. Don't try to trach your baby. If you ever watch Grey's Anatomy, don't try to trach your baby. That can end up really bad. So next time I decide to give her a peanut product, I'm going to do it in the doctor's office. So to do an oral challenge there, because I don't really know. So my baby does not have eczema from what I know so far. It doesn't really run in my family. My niece has eczema, but she also has another side of her family. So when a kid has eczema or allergic dermatitis, they are more susceptible to food allergens. I read that there's a breakdown in the skin, and because of that breakdown, proteins of the allergens can get through the skin and I guess cause an antigen reaction. I don't know. But allergies tend to run together. Like if you have, like someone that has, like say I have seasonal allergies, and that's it. But someone who has asthma, they have eczema, and they may have a peanut allergy, and they may have a milk allergy, they may also have an egg allergy. So allergies tend to kind of run together in groups. They're actually grouped. If I find a chart, I will put it here. I'll look for one though. So early onset eczema, if your baby is 3 months or less, or has just very severe eczema, atopic dermatitis at all when they're younger, they are associated with high hen egg allergy, cow's milk, and or peanut allergy. I'm also gonna put the hypersensitivity reaction chart up, but I'm not gonna go into that because allergies are super complex. If you ever wanna look up how allergic reaction works, go right ahead, but give yourself a weekend to really learn the information because it's super complex. Basically, we never know what's gonna happen in an allergy, and we should always be alert. So some things that are used to treat allergies and that I think moms should always have on hand at least is Benadryl, right? Like Benadryl, we don't want to give Benadryl to young kids because Benadryl can increase convulsions and rapid heart rate in infants, which is bad, right? It sounds bad. But if an infant is having an allergic reaction, by all means, give the Benadryl. It's not really recommended for kids under 6 months. It's not really recommended for 6-month-olds either, but sometimes you may have to give them something. Like I gave my daughter 1 dose once because she was super congested for like a week and she couldn't breathe. I was holding her up every night and I wanted to see if it could give her some relief. Like her nose closed and I can't just give the baby Afrin like I gave myself. So, yeah, that's a whole nother situation. But you want to keep it on hand just in case because it's risk versus benefit, right? So if your baby their throat is closing up or something like that, or it could get to there, you want to give them a dose of Benadryl. More than likely, you'll give a half of a 12.5 dose, which is 6.25 milliliters. Well, it depends on what it says on the box. Let me not say that. Because if a kid's dose is given of 12.5 milligrams per teaspoon, an infant dose is usually half a teaspoon, but it's also based on weight. So it depends. Like my baby is a big old baby. She's over 20 pounds now. So I dosed her based on weight for that 1 dose that I gave her. It's very important that you just don't willy-nilly give a baby a Benadryl dose, and you really want to let your pediatrician know or ask them beforehand or someone like that. Since I'm a medical professional and I've had lots of experiences with different things, I knew to, give it to her, monitor my baby, give it 1 time, just watch her, see what the reaction did, and that's it. So when kids if your kid starts having allergies, or they have eczema and, you see a hive or a rash or something happening and you think, okay, this potentially could be an allergic reaction, there are different things you can do. Like there are skin prick tests, which you may have seen on movies. So there would be a various amount of antigens, usually plants, ragweeds, things like that people are usually allergic to, and they will prick it into the skin of the person and it'll cause some kind of reaction. Like you'll see reactions and they'll measure the reaction and say, okay, this is an allergy, this is not an allergy. Also, like me with the peanut allergy that she could potentially or not have, I'm gonna do the next challenge when she's at the pediatrician's office because I don't have an EpiPen. I cannot save this girl's life if she goes into anaphylaxis. I will be freaking out. Which is the next way of treatment. So antihistamines, EpiPen. If you feel that your child may have a bad allergy as they age, like my first daughter, I thought she was allergic to strawberries for a moment because she was eating strawberries and she would get like really flushed and red and kind of swollen, but it wasn't that. I think it was the sun, it was something else, but she eats strawberries all the time and nothing. So I wanted to get an EpiPen. I mean, pediatricians don't just really want to give EpiPens just randomly, especially if there's not really an allergy, because you have to basically stab the leg of your child to give them the shot of epinephrine, which is an intense reaction in itself. But if they do have allergies, you do want to have an EpiPen at all times. And EpiPens, their expiration dates are usually short, so you want to check it all the time and then check the window for cloudiness. If you have an EpiPen, you'll know what I mean by the window. There's a little like clear plastic part on the EpiPen where you can see the liquid inside, which is clear. It should always look clear. If it ever looks cloudy, don't use it. Don't use it at all. Okay, so also for any moms, dads out there that are interested in challenging their child with a peanut allergy, to see if they do or don't have a peanut allergy, or to prevent a peanut allergy, like what I want to do by exposing her to peanuts early in hopes of preventing it in the future. I mean, she may not have one anyway. There's no one in my family that has a peanut allergy, so I don't know. But do not give a child peanuts. Please don't. They are a choking hazard. It will not go well. You can put peanut butter on bread, like make a slice of bread, like a small slice, like especially if you do baby-led weaning, they can hold it. There'll be a little bit of peanut butter on it. They're kind of, gum it. They'll get some in their mouth and you can see. Or you can buy the Bomba Snacks, which is, they don't have to have the pincher grasp yet. They can use I think it's the plantar grasp, and hold it in their hand because she's not old enough to use her fingers yet. So I highly recommend, challenging for peanuts. If you feel uncomfortable though, do it at the pediatrician's office or let the pediatrician know that you're doing it. I don't recommend not being informed when doing things like this. Anything could go bad at any time. But all children kind of have to be challenged at some point. So you might as well do it early and, hopefully it'll decrease any risk that they have. Because they're going to be exposed to peanuts at some time in their life, with you there or not. So let's set them up for success and do it in a controlled environment where we are watching them. So yeah, that's what I have. Thank you so much for listening. If you have any questions, either hit me up on my Instagram. I am Dr. Chandra Lynn. I also have an Etsy store and a Pinterest and a TikTok. I talk about a myriad of things. But right now my focus is children's mental health and baby stuff and mental health and all sorts of things, actually. But anyway, thank you so much for listening. Let me know if you have any questions or concerns. Make a comment, like the video, subscribe to the page. Let me know if there's anything you want me to talk about, and I will.